Hello, everyone. To avoid the good morning and good afternoon greetings, together with Eltjana, my colleague, we'll want to share a bit our experience during this last year, going from a fully face-to-face paper-based assessment processes to a remote one. It has been quite an interesting journey, let's say, with a lot of challenges and learnings. So, but before starting, maybe to share just a little bit of information about the project, Skill for Jobs. It's a project of Swiss Agency for Development of Cooperation, implemented by SwissContact in Albania, in partnership with Ministry of Finances and Economy, and it aims to improve the access towards employment, gainful employment of youth, by offering them relevant training opportunities based on new ways of learning and in cooperation with the private sector. The project has started in 2016. This is actually the second phase of it, and works closely with 9 providers in public vet schools in Albania and 1 training center. There are 43 of them in the whole country. So far, around 16,000 students have benefited from the project's interventions. So this is only a few words to understand a bit what the project does. I want to go on now explaining a bit our, let's say, measurement methods we use as part of our MRM system. Due to the dynamic context of the project, it's important to implement as we go also action research and different assessment in different times of the implementation, along with the set ones, that is the annual assessment and the tracer study to assess the impact of the project activities. Usually, the assessing impact and assessing outcomes and outputs, it's once a year, and it's in a set period of time to allow also comparison from one year to another. But actual research is more when needed. It's to follow and to accompany, let's say, interventions, different intervention or new intervention that we undertake. It is sometimes it's planned, but sometimes it comes also as ad hoc, which was the case, for example, during distance learning process in vet institutions after the schools were locked down. So for each of the indicators and intervention, we define first what data will be collected. Moreover, we use triangulation in sense of mixing qualitative and quantitative methods, but also multiple sources of information to validate the data and the results. So far, until March 2020, all of these measurement methods were undertaken face-to-face and paper-based, with the exception actually of the tracer study, for which we use the computer-assisted self-interviewing method, but Eltjana will explain a bit more about it. So to go in a case of an action research, so the first remote assessment implemented by the project has been in early March 2020, only 1 week after school lockdown happened in Albania. The main goal was to understand the challenges faced by vet schools during this distance learning, and to improve teachers and students' experiences and performance during the remaining of the academic year. So for the first assessment, which served to us also as a baseline, we were kind of unprepared. It was quite sudden, and we wanted to really understand what was going on since the beginning. So we developed an ad hoc survey for teachers and students, trying to grasp the situations, and at that time using Google Forms. That was the first tool that it came in our mind to actually use for the remote assessment. The survey then was administered to all students as teachers. We didn't sample. We went for census because we didn't know how to sample it at that moment. And surprisingly, the response was quite positive and very quick. So probably everyone was in their mobile's phone, and a part of getting picture of books to learn, they were getting also some kind of link to answer some interesting question. We try to be very short and clear, let's say, in our questions. Then the follow-up survey was after around 4 weeks, and at the time we're better prepared, and we made the use also of the result from the baseline to actually consolidate and build an instrument which would serve better to our purposes. Moreover, in this phase, in the second assessment, let's say, the information was also triangulated using for the first time focus group discussion through Zoom meetings. And in order to reach students without internet access, we had around, let's say, 15 to 20% of students in remote areas which did not have access to devices or to internet. So making use of good administrative data, we actually could reach them using mobile phones and to get their voices in as well. So this has been a bit our first experiences, which was kind of fuzzy, but also we learned a lot. But now I'll leave the floor to Eltjana to explain a bit more on technicalities on how the annual and the impact assessment has shifted during the last year.
Okay, so as Erka mentioned, in our MRM framework, we use the annual assessment as an instrument to actually assess the effectiveness of our interventions. This year, we implemented the 5th annual assessment from January until March, so it's quite fresh. The difference this year was that we did it completely remotely, obviously, and that's one of the cases that we wanted to present because we had very interesting insights as far as our MRM job is concerned. So basically, the annual assessment is made up of 2 parts. First, the quantitative assessment consisting in questionnaire, standard questionnaire that we used from year to year. We tried to keep it as similar as possible in order to preserve the comparability feature. So we had during the, let's say, 4 rounds, except this year, a questionnaire of 45 questions to assess 5 interventions of our project. And it was as I said before, traditionally deployed on site. So we had a team of short-term consultants that were going to our 9 schools, 10 institutions. We have also 1 BTC in 6 regions. So it was quite, let's say, a struggle in terms of logistics, because imagine spread all over the country, we had to coordinate all these consultants. And it took a lot of time. It took 4 days time to complete the set of questionnaires. So we went obviously for sample because it would have been very labor intensive to get answers from all our students. And then the data entry process, it took almost 1 week to pass all the data from questionnaire, the paper-based questionnaires, into Excel, and then further time to analyze the data and to produce a report and so on. So actually COVID as far influenced kind of positively this process for us, because it forced us to make it online. And it was a nice exercise. We had, first of all, to shorten the questionnaire, because obviously it was, well, from paper-based, we had to then go into digital questionnaires that if they are too long, probably the response rate would then diminish. We didn't want that, so we tried to shorten a bit the questionnaire. So from the traditional one, including also COVID-related questions, it was then 40 questions long. So we used the COBA toolbox, and maybe many of you have used or heard about it before. I'll explain the advantages of this tool a bit later, where I have summarized, let's say, the lessons learned and recommendations for all of you. But then it was also very nice let's say, exercise in terms of time that it took, because we only used the help of our 3 coordinators. In 2 days' time, we had collected all the answers from our whole population, which the response rate of 54%, which was quite good, actually. And the data entry then was automatic. It took no time because with Kobo we had all the answers in to be exported then in Excel automatically. Yeah, so this was about the annual assessment. I'm gonna talk about some challenges then about the annual assessment, but before that, I'm gonna explain a little bit also about our tracer study, which is our instrument to measure impact. So through this, through our tracer system, we collect data from graduates 1 year after graduation, and we ask them about their employment status, income level, and the relevance of studies, which are all indicators at impact level for our project. So traditionally, we had done also the tracer. Actually, we had done it through the computer-assisted self-interviewing method. We have a very consolidated tracer system in our partner providers, which are the 9 schools and 1 VTC. But this time, we were asked to support the national agency, one of our partners, for National Agency for Employment and Skills, to scale it up to the national level. So it was quite interesting challenge for us, because from now 10 providers, we had to go into 44 providers, 10 VTCs, 34 schools, the whole population of trainees and also graduates in Albania. We actually relied before in our, let's say, partner provider coordinator. They had done this exercise for 3-4 years, so they were quite capacitated to do it. But we had many challenges actually to do it for the other schools, because there were no trained coordinators in these other schools. Because also our project, it was our project initiatives to train the coordinators, but from our school they didn't for other schools they didn't receive any kind of training. So to mitigate this problem, the idea was to then contract some enumerators and train them, not to train the tracer coordinator schools, because they have limited capacities at each school and we didn't want to lose time. We assisted also these enumerators during time, also except the training sessions. The difference between the 2 tracer studies, the one that we did the 4 years with our partner providers and the one that we did now, was the method that we used. We used Kobo in both cases, but the first time it was self-interviewing, so the tracer coordinators would distribute the link to the students, they would answer and then would collect the data through Excel. But now it was computer-assisted personal interviews, the CAPI method. So it was the enumerators that were calling every trainee and also graduate student and asked them the questions in the questionnaire, which resulted in the end in a lower response rate, because many people didn't answer the phone call. And then since we are here, I'm going to talk about a bit the challenges that we had. So for the tracer, the main challenges was the database information. As I mentioned before, we had a very consolidated tracer system in our providers, but we didn't have a good databases for the other providers. And we had like wrong phone numbers, obviously, phone numbers that were not corresponding to the person, but were a bit mixed up. So all these problems that we had with the databases lowered our, let's say, response rate a lot to 30%. That was the main challenge. And also we had challenges about the infrastructure of data collection, because at this national agency, the enumerators were working in shifts. They didn't have many computers. So It was one of the problems that we had, and they also had problems with internet connection. So then for the annual assessment and the action research, we had a bit of a hard time to have teachers on board during these stressful times, because you know, they already were delivering all the teaching, all the lessons online, and this was an extra burden to them. Also, another challenge that we had was to shorten the questionnaires, but without losing comparability. We try to prioritize here and maintain the questions that were more important, and then shorten where we could. Then something that we made was to manage the response rate at real time. While we were collecting the answers, we were seeing how these answers were distributed. And then through our team of coordinators, we tried to push a little bit more those grades or those directions of study that hadn't, let's say, students of which hadn't answered a lot. And in some schools that we reached a very satisfactory response rate, we closed the questionnaire before the assigned time in order to have let's say a good distribution across grades, gender, and study direction. Then another risk that we considered but then didn't materialize was the risk of teachers' influence. Since the teachers were in charge to, let's say, distribute the questionnaire, they had a little bit of conflict of interest there, because we were asking also about questions about the teaching and learning process. But we saw that everything was quite transparent, and we received all kinds of answers. We didn't receive like very good answers about the teaching process. So this made us think that this risk didn't materialize at all. So very quickly now I'm gonna summarize our lessons learned and recommendations for you all guys. It's a bit ironic, but COVID made remote assessments easier in the case of annual assessment and also action research, because teachers and kids now had improved digital skills, meaning that there was higher readiness. We didn't have technical problems in terms of using COBO or using or answering the questions, so we were quite satisfied by that. Then we highlighted a little bit the importance of selecting the most appropriate data collection instrument. We used both COBO and Google Form, but the advantage of COBO were two. First of all, in terms of let's say creating the questionnaire, COBO allows filters and that are very easy to use. For those that have already used it, they know. And then also it's free and it's used on mobile and personal computer, and it also allows offline data collection. Not fully offline. The thing with COBO is that if you are completing the questionnaire and your internet connection goes off, then the information will be stored in the COBO clouds or whatever, and then you can resume it where you left it, and everything will be saved. This is not applicable to Google Forms, as far as I know, at least. Then another lesson was to go for census rather than a sample. Remote assessment are quite cost efficient in this framework. So it's a part that is difficult to have a sampling frame to sample. Also, because of the less cost, we could go for census. And also because there are some problems with the databases often and the internet connection and so on, and that would further lower the response rate. It's better to go for census rather than sample. A few more points by our side as lessons learned. So shorter questionnaires work better. The fact that we shortened the questionnaire, actually we saw that it was good because we reached a very high response rate in the annual assessment. It's very good to leave space for comments at the end, because you find there a wealth of information. By analyzing the comments at the end of the questionnaire, we actually draw very nice insights that we will now use for the qualitative assessment for the focus groups. And then it's very recommended to continuously update the contact databases, not to wait for the moment of the assessment, but to do it throughout the year, and try also to make some tests and call randomly, let's say, the students or what is your target group beforehand, to see whether the databases are, let's say, at good quality or not. Then remote assessment, as I said, can be very cost efficient. You save time in human resources, on transportation, on printing and other logistic materials. Then remote assessment can mitigate the risk of influencing the respondents sometimes, especially those that are directly administered by the respondents and without having, let's say, coordinators or teachers, or as it was actually in the case of our action research example. Then it's very, very important to train and motivate the call center enumerators. Yeah, we had some challenges here. Because the enumerators were new to the project, they didn't understand much about the context and everything. And we tried to train and support them throughout the time. It's very important also to tell them to record the non-response, take some notes about the non-responsive people, meaning that sometimes people don't respond because they are at work. This means, for example, in the case of our tracer, that our target group is employed, and we can note it down as, and we can get some of the information then. And then relying on skilled coordinators is crucial. For us, has been of very good help, especially in the case of annual assessment. And also making use of skilled facilitators in case of GDs. And here we suggest to have two facilitators, one that takes notes and the other that is engaging the group and the discussions and encouraging the discussions. At least this is a practice that worked in our